In the midst of the coronavirus, expectant moms preparing for birth are no doubt facing anxiety. All patients admitted to a Baystate Hospital are tested for COVID-19, but some mothers who are worried about being separated from their newborn babies are declining the test. Dr. Heather Sanky, the chair of the Department of Obstetrics and Gynecology at Baystate Health, discussed the issue with Carolee McGrath.
There's a lot of confusion out there about what tests are available and what they mean, and even healthcare workers are trying to figure that out. Um, but what we started to do at Baystate was to test everybody so that we have a better idea of, who was infected, how to cohort them, so to keep uninfected moms away from infected moms, those kinds of things. And we initially started the testing. There was a lot of anxiety about having the test, more than I expected. That surprised people in the rest of the hospital because everyone else being admitted is being admitted because they're sick, and of course they accept the test. We have found that has changed somewhat. Some people still, it's an uncomfortable test to have done. It's deep into the nasopharynx. And some people are just anxious about the stigma potentially. Some people just don't think that they're going to be positive. But we are finding about 5% of women with no symptoms whatsoever are positive. We're very happy that it's that low, but that's an important thing to know.
And how dangerous is that for the baby?
So fortunately, we are not finding that the baby contracts COVID-19 in utero. So at birth, every baby we've tested has been negative, and that's consistent with what we've seen worldwide. The risk to the baby comes after birth, and it's based on the same risks the rest of us have with the contact, hand-to-hand secretions, droplets, etc.
And tell me a little bit about the concern with moms being tested on the way in. Obviously, there's a lot going on when you're going in to deliver a baby, especially when you're in labor. So that's a difficult time anyway. But there has to be that added concern is, oh my gosh, if I'm positive or if my husband's positive, now we're separated from this baby.
So we're not testing the support person. We're testing only the woman who's admitted in labor or for birth. So what we are doing is if she's completely asymptomatic and the support person is completely asymptomatic, then we allow them to stay. At the time of, so once we discover that someone is positive, we have a discussion about what the best way is to care for the baby. And that is shared decision-making is used with the family and the providers so that we can make the best decision for baby in that family.
And what does that mean? Does that mean that the mom, let's say the mom is asymptomatic, can the mom breastfeed? Can the mom bring the baby home? Can the mom hold the baby close? How is that handled?
So breast milk is still best for baby at all times. So what we do is we discuss the options. So the safest thing for the baby while in the hospital could be separation from the mom and put it in an isolated room. When the baby's premature and has another reason to be, for instance, in the neonatal ICU, then that's the logical option. The mother can continue to pump breast milk and that's fed to the baby. The option for a woman where the baby is fine, would otherwise room in with her, is to keep the baby in the room, but separated by 6 feet. And in this case, what we advise is that the mother sanitize or wash her hands and her breast prior to breastfeeding. She could also pump and have somebody else feed the baby. If she chooses to breastfeed, we ask that she wear a mask and she clean her hands and her breast, and then she breastfeed. So it's probably best for baby in terms of infection risk to spend less time being held by mom. That doesn't mean they can't be held by other people. But again, recommending the contact precaution.
And what happens, when that's not mom's first baby? Maybe she has 3 other babies or little kids at home, and now she's asymptomatic, but there's a concern there. How do you help that family manage? And I think, again, that concern is, oh my gosh, I don't want to be separated, right, from these children who need me.
And it's a very big concern. Up until recently, we have not been particularly concerned about children and infants getting sick. But now, I'm sure you know, there's some recent articles about a delayed illness that can occur, and I'm not a pediatrician, so I can't speak to that. And so what we advise is that the pediatrician be involved and advise the best way to care for the mother to care for the other children. The problem is that she may have in fact had COVID several weeks earlier, but the test that we do can remain positive even though she's not infectious. So really that's part of the reason for shared decision making. We have to help figure out whether she's pre-symptomatic, completely asymptomatic, or post-symptomatic. and that will differ our recommendations.
And you also mentioned testing the baby. Is that done with every baby that leaves the hospital?
No, for any mother who ends up testing positive, we do test the baby. Again, the only time we've had a positive was someone who was unknown COVID, became symptomatic and was tested. And so what unfortunately must have happened is the baby became infected during the first few days of life.
And tell me a little bit about, as far as just advising people, you had mentioned the numbers for infants, and certainly the CDC numbers for children contracting COVID-19 are low. I think the CDC said less than 2%, but surely as a mom bringing home an infant, you're worried about anything. Are there things to watch out for that would be different with this?
I think what we have to remember is that while children are not getting sick, they are thought to be carriers, and that's the risk. And so, each family, based on their living conditions and their situation and what supports they have, is going to have to make that decision about how you isolate, if you can, from your other children. Typically, when you see one family member who has it, you see most family members have had it. So it might be that those other children get tested to see if they are positive. Because if mom and baby are both positive, there's no reason to separate them. If mom and her other children are both positive, you really want to be careful about them getting too close to the newborn.
And are there symptoms to watch out for that newborn? I mean, obviously a fever or anything else, difficulty breathing?
Yeah, I think any symptom that's unusual, you call your pediatrician and ask them. Again, I'm not a pediatrician, so I don't want to, but we look out for the same sorts of things. So any illness, the pediatrician will help sort out whether COVID testing makes sense.
Would this be a similar protocol, let's say, if the mom came in to deliver and she had the flu or was leaving the hospital and developed pneumonia? Would you have a similar sort of set of standards or standard of care?
That is a very interesting question. So influenza can be very serious in pregnant women. We use the same precautions or very similar precautions when a woman is known to have influenza. I don't know that we've been as careful about spread to their children at home as we are now with COVID. And I think this is going to change how we think about it in terms of our education. But it's a much higher alert thinking about, how can we benefit women and families by teaching them to minimize spread of infectious diseases.
And just on that last note, how do you reassure moms who might be due tomorrow or next week, that you're ready to care for them and all will be well?
I will tell you, during the last 2 months of this experience, we have done everything we can to keep our healthcare workers, our patients, our hospital setting to be the safest place you can be. I am confident coming in every day that I am going to be safe and not infected. And I want to reassure anybody coming in for labor or for birth that we will take care of you.